Well, psychiatry, for me, it's the most diverse medical specialty. We can have input from such a variety of disciplines. There's neuroscience, there's social science, there's art.
So I actually started as a PhD student in psychiatry, and then only after that I continued into clinical work.
And I'm training to be a child and adolescent psychiatrist.
I'm working with patients with early psychosis and addiction disorders as well.
I'm very interested in psychoanalysis because mainly it reminds me that there is a part of us that we don't know and that we will never know, and that's fine, and we cannot rationalize everything, and well, we have to deal with it.
What does psychiatry mean to you?
Psychiatry is like my second love for me, after my wife and my daughter, of course.
Psychiatry is a very important part of my life.
It's such a curious and interesting combination of science.
For me, it's now became more than just a profession. It's been a calling, actually. At some point, it just turned to being a calling.
Because I've always been fascinated by people. I always wanted to know what is the core of humanity and what makes us so different and in other ways so similar.
I see psychiatry as this final frontier of medicine. I think it is the field of medicine where we have so much left to discover. And I really want to be there at the front row when it happens.
Well, psychiatry, first of all, has offered me my own insight about my thoughts, my behaviors, my attitudes, my communication with my patients as a medical doctor in general.
Psychiatry has changed my life in a way that I never imagined even. I've gained so much in terms of confidence in myself, and that has been largely due to being in psychiatry, seeing patients every day, working in a team, leading a team, going abroad and meeting other psychiatry trainees, becoming part of this international network of a family of psychiatrists.
I would not say that psychiatry changed me. Psychiatry developed me a lot.
It has broadened my horizons.
It made me more patient. It also made me see that there are so many ways to reach from A to B, and not every road and every path is familiar to me, or not every path I feel comfortable with, but still it's worth walking if the patient wants to walk that path.
I love my patients. Children are so sincere and front-coming, and it's really rewarding. It can make a big difference. Not for the child alone, but for their families and future families to be formed by those children.
We're dealing with mental illness, and we live in a society where mental illness causes a lot of exclusion, stigma. I'm really proud to be taking care of those people.
I suppose it's like being able to see the big picture, to learn the stories from the very beginning, biological perspective, and then through the lens of time or events that could have shaped those stories. And then there's also this amazing opportunity to help people change those stories or make some new stories, rewrite some parts, do things that they feel comfortable with in their own terms.
Advice will be like to choose what you love, because when you're doing the job that you love, you're getting tired less, and even if you're doing the hard part, it makes it easier and you're getting satisfied.
That's fine, you don't need to rush things, so you have the time in front of you, choose wisely.
So I would advise my young medical colleagues to be patient on the first place. You don't have to be sure immediately.
And I think you should just listen to your guts, and it should be fun. It should be nice. It should feel right.
Great, thank you.
Superb.